where we teach you that your health is your responsibility. Siyabonga kakhulu ukuthi namhlanje nihlanganyela nathi kulo lohlelo lethu esilithanda kakhulu. Siyathanda futhi kanti ukuthi sibonge the bishop and Bishop baleli khaya for giving us this opportunity to actually reach out to you so that you and I together do better when it comes to our health. Kanti-ke we are continuing today ngazo ezempilo. Siyakumbula ukuthi-ke ngeviki elidlulile we were wrapping up actually our series on mental health. Kuwukuthi sizobuya siqhubeke nayo. So today we are starting and we're going to be talking about the new kid on the block. Yes, I am calling it the new kid on the block. Kanti mhlambe abubukeli bayabona lapho ukuthi sinawo ama-mask sibekile lana ama-visor kunzima. Yes, we will be talking about a coronavirus. Kanti ke ngingakamoshi isikhathi, I would like to introduce to you today our guest, Dr. Lesego Motibi. Kanti ke she will be telling us more about herself and what she does. Hey, Bageti, it's packed. She works currently at the Chris Hanna Barakwana Hospital, and she will be telling us ukuthi kahle kahle wenzani. Yes, she is a pathologist. Manje sifuna ukwazi from her ukuthi iyini benzani singakangeni kulo uhlelo lethu. Doctor, we welcome you.
Thank you for having me.
And how are you, Doc?
I'm fine, yourself?
We're very well, thank you.
Thank you.
You are a pathologist.
Yes, I'm a pathologist.
Ababukela emakhaya may be wondering ukuthi thina besicabanga ukuthi kuno udoctor doctor or a pathologist. Like, please can you tell us ukuthi what is a pathologist and what do you do on a daily basis?
Okay. So being a pathologist, for someone to be a pathologist, you have to do a medical degree first.
Okay.
So you do a medical degree and you specialize in pathology.
Okay.
So with pathology, there are different disciplines of pathology.
Yes.
So there is the ones that we know, the pathologists, the anatomical pathologists who are, they deal with autopsies, they diagnose the cancers, they take your tissue. If a doctor, maybe the clinician suspect that you have cancer, they will, take a piece of that tissue or that part of the bone and be able to diagnose cancer.
Okay.
And then there's also a clinical microbiologist, which I am.
All right.
So I'm a clinical microbiologist. So with clinical microbiology, we basically deal with diagnosis of infectious diseases.
Okay.
So diagnosis of infectious diseases, prevention of those infectious diseases, and control of those infectious diseases, of which coronavirus, TB, HIV, listeria, and things like other bacteria and viruses that causes meningitis are what we diagnose.
Okay. So, doctor, when we're saying infectious diseases, mentioned like our TB isn't telelanayo. Like, is that what infectious diseases are? It's those diseases that are like, well, contagious, can be spread from one person to another.
So infectious diseases are diseases, yes, you're right, they are contagious. They can be spread from one person to the other. But what is important is they are caused by what we call microorganisms.
Okay.
And when we talk about microorganisms, it includes bacteria, viruses, parasites, fungi, etc.
All right. I guess siyabonga kanti ke usuzwile mbukeli emakhaya ukuthi abodokotela it's not just ukuthi bahleli babona ama patient ngaso sonke isikhathi kukhona abodokotela that actually work ngako ukudiagnose lezi zinto lezi bathatha ama specimen benza lokho nalokho. So it's actually a very broad field. Being a medical doctor, there is actually so much that one can do. So today, doctor, we are talking about coronavirus. You know, it's the new kid on the block, Mara. You know, it's on everyone's lips. Everyone is talking about a coronavirus. Like, you know, there's a whole lot of anxiety around coronavirus. And so today, we'd like to just really sitshele ababukeli gabanzi on what is it, what can I do, etc. So please, doctor, let's start by defining coronavirus.
So when we talk about coronavirus, I know, it's something, it seems like it's new.
Yeah.
When we talk, So when you talk about coronavirus, it's a group of viruses.
Okay.
However, the one that we are faced with now, it's a novel one, meaning that it's new.
Okay.
So just to make an example, you know, you can have a family of maybe guno malume, guno babu mncane, etc. And in that family, you have cousins.
Okay.
So this coronavirus is a group of viruses, and they commonly cause cold or common cold.
Okay.
They are the most common causes of common cold.
Okay.
However, they differ. You know, there'll be cousin 1, cousin 2, cousin 3, etc. So
Okay.
in this group, like I say, we have lots of coronaviruses. However, there have been coronaviruses that have caused pandemics in the past.
Okay.
So one of them is in 2012, if I'm not 2011, 2012, there was what we call MERS coronavirus. So it's Middle East respiratory syndrome coronavirus.
Okay.
That was that. And then around, I can't remember the year, whether 2008 or so, there was another one, which was also novel at that time. So it's like a new kid being born in that family of coronaviruses.
Okay.
Different strain, if you have to put it that way. So that one was called the SARS-CoV.
Yep.
Okay, so it was it's a severe acute respiratory syndrome coronavirus. So now this one, the pandemic one, the two ones were also caused pandemics. And then this one, it's novel as well in terms of the fact that it's new. It's like a new child being born with different genetic components. So this coronavirus, the novel one that we're dealing with now, it's almost the same or shares genetic similarities with the SARS-CoV, the initial one. So remember when we started, before we gave it a name, it was just called the novel coronavirus 2019.
Yep.
And as they do genetic analysis and they see the genetic similarities between this one and the previous one, that's when they named it SARS-CoV-2.
Okay.
So the name of the virus is SARS-CoV-2, and the name of the disease is COVID-19.
Hey, hi, Babugeli. Babugeli, siyafunda. Wow, doctor. Actually, quite eye-opening. I think a lot of people didn't even, we just call into because we are told to go to ibizwa kanje, but you really don't understand, everything behind that. Thank you for that, doctor.
Okay, thank you.
So now, doc, how is this, before we get to the symptoms, how is it transmitted?
So with coronavirus, one thing about, anything that is new, there will always be, we think it's transmitted this way, and obviously new ways will be seen that, okay, it's not this way, it's this way.
Yes.
However, what is established at the moment, and which is what we know, is that it is transmitted by contact.
Okay.
I'll come back to that.
All right.
It's also transmitted by droplets.
Okay.
So when you talk, when you sneeze, and during coughing, you produce droplets. And usually these droplets will travel in a sort of, we call it an aerial direction. So they will travel. And so the difference with droplets is they are quite big.
Okay.
Not big visibly, but they're about 0.5 microgram and larger. So when they get, when you sneeze or when you cough, when you produce those droplets will not be able to travel a longer distance.
Okay.
So they get dropped.
All right.
So they sort of like fall because of gravity to the ground.
Okay.
So that is droplet spread. So with droplet spread, remember when you when you produce those droplets, it means that they can be, as you cough and you sneeze, it can get to that phone, and then when it gets to that phone, someone else's touches, and that's what we call contact transmission. So you touch that, you touch your eyes, you touch the nostrils or you touch the mouth. And that's how coronavirus will be transmitted.
Okay.
So the main route is droplets, and with droplets, for example, with those droplets, you can, with my droplets, if I sneeze into my hand, I can touch a doorknob, and that doorknob means it has those viruses, and if the next person touches that, and that's what we call contact, direct contact transmission. And then there's obviously there are new ways. They have recently discovered that not only will it be through, contact and droplets, it can also be transmitted. There is that hypothesis that there's a possibility of it being transmitted by airborne. So the difference between droplets and what is airborne, for example, TB is airborne.
Yep.
Measles is an airborne infection. So the difference between droplets spread and airborne is the size of the particle.
Okay.
So with droplets, like I've said, they are more than 0.5 microgram, whereas the airbornes are smaller, and then they can travel, because they are smaller, they can travel to a longer distance, if you have to say. Yeah.
So now, Doc, with the contact, how long on a surface, someone may be wondering, it's okay, let's say, I sneezed or coughed with my hand and I touched this phone, and maybe 2 hours, 3 hours later, someone comes and touches the very same phone. Like, do we have a time period to when it actually survives on contact, on surfaces?
So what has been found, obviously, this is something new, and there is a lot of research going on. However, what has been found is, obviously we discover new things all the time.
Yes.
I don't have the exact number of hours, but recently what has been found is when you compare in terms of your smooth surfaces, like maybe on a steel, on a smooth surface, maybe a plastic or a metal, it lasts longer than on paper.
Oh, okay.
So on paper it does last, but it will last longer on your smooth surfaces, like your metal and etc.
All right.
And some studies have shown that in metals it can last for 6 hours, and with others saying that it can even last for days. So what is important with infectious diseases or with bacteria, viruses, it can last there, but is it when you get, maybe you do the genes, you find that, the genes of coronaviruses are there. But the thing is, are they alive?
Okay.
And if they are alive, are they infectious? Most of the time, obviously, if it's alive, it's infectious. However, when it's dead, it cannot cause infection. So those are the things that are still being established.
Okay.
How long it lasts, how long does it last as being infectious? Those are the things.
So those are things that are still being studied and discovered as we go. 100%. Now, Doc, from as you say, things have been changing. At one moment we were told this is important, and now, suddenly that is no longer as important. Can we please talk about the key signs and symptoms, manje, what we are currently using? And another thing, we're reading a lot, and there's just information overload, and something happening maybe in another country out there may not be what we in South Africa currently are using. So can you just please tell us what are now the key signs and symptoms that one needs to look out for?
So in terms of signs and symptoms, like you've clearly said, there's research going on. So your typical signs and symptoms, and it doesn't mean that each and every person will get those symptoms. But one of the most common symptoms is fever.
Okay.
However, there are patients who will present without fever. The other symptom is cough.
Okay.
If it's severe, you can have shortness of breath, chest pain, excuse me, and one of the symptoms that was established maybe 4 months down the line was a loss of sense of smell,
Okay.
which is called anosmia in medical term. So anosmia was one of the symptoms that was added.
Yeah.
And with time, more symptoms have been added.
All right.
For example, diarrhea diarrhea and abdominal pains have also been one of the symptoms that patients present with. And with research as well, you know, with infections or with diseases, we always say this is a syndrome. And when it's a syndrome, it means that, you know, it presents with a lot of symptoms. It's not one particular symptom.
All
It
right.
can present with a group of symptoms. And with coronavirus, there's actually a lot of things that it can present with. It can present with strokes, because what it does, it can cause blood clots. And when those blood clots dislodge, they can dislodge to the brain, causing strokes. They can dislodge to the heart, causing heart attack. And it has also been found to affect the pancreas, with patient presenting with new onset diabetes. So it's actually a multi-system presentation. However, the most common symptoms are the respiratory symptoms.
Okay. And now, doc, one is probably wondering, okay, let's say now, you know, I'm suddenly experiencing these symptoms. It could be maybe the loss of, you know, smell or taste or whatever. Like, after how long, when do I decide I need to go and seek some help? Like, when do you decide to go for medical attention? Do you stay at home and try to nurse this? You know, a lot with, you know, the common flu, you know, you don't want to go and do anything. You sit at home, you know exactly what, you know, if I take this or if I take that, then I can deal with this. So should you also do that with this COVID-19, or immediately, like, what do you do?
I think, you know, it's a very tough one. But I would say with, let's say you present with, you feel you have sore throat, which is one of the common symptoms that I forgot to mention. Let's say you have sore throat and you're starting to feel feverish, you're coughing. So you need to at least watch your symptoms. If your symptoms are worsening, despite rest, despite having, you know, maybe having taken some painkillers, some flu medication, and you're still not feeling well, because of the increased number of cases and the chances that, you know, we're going to be coming into contact with other people that are infected, I would say in 48 hours, if you worsen, at least seek medical help. So at least 2 days, don't sit with the symptoms that are not improving without seeking medical help.
Wow.
Number one.
Okay.
And then secondly, for obviously with worsening, it may be less than 48 hours, but if your symptoms worsen, even within 24 hours, especially with shortness of breath, chest pains, and those severe symptoms, I think that warrants someone to go and seek medical care.
Wow, okay. Babugeli ngiyathemba ukuthi sizwile uthi udokotela if ama symptoms wakho if uyazi ukuthi yazi ukuthini awubi ngqono, instead uba worse, 2 days is enough. Hamba uyofuna usizo. Kanti ke if within a day, mhlawumbe it's not even leyo 2 days, mara uzizwa worse man, usuzamile mara akukho okusebenzayo, ungalindi, go and seek medical attention. Kubalulekile. Why? Because, you know, we are constantly in contact with people, and awufuni kanti ukuthi uma unayo kube ukuthi wena mhlawumbe usunikeza abanye. Remember, you know, with health, it's not just into yomuntu oyedwa, but you know, my health, your health, together, sonke siyasizana. If I am okay, it is not just for me, but it is also for you and the next person. So now, Doc, who gets coronavirus? You know, kukhona abantu mhlambe bangayitholi kukhona abantu abaku a higher risk, you know, there were so many things that there's so many things that are in social media, you know. At one point, doc, it was that thing, but you know, if you are healthy and you are young, you're actually going to be fine. But we know now ukuthi it, you know, even the youngest, even the healthiest of people, nabo, you know, they have contracted the virus. So please, can you just try and clarify ukuthi ubani uyitholayo?
Actually, with coronavirus, everyone and anyone can get it.
Ay, siyabonga dokotela.
So the difference is when we talk about people at risk, those people that at risk category is people that are at risk of developing severe disease.
Okay.
So I think that's where sometimes the confusion comes. People think, oh, the diabetics are the ones that are going to get it. I'm not diabetic, I'm
So
young,
right.
I'm not going to get it. Each and every one of us can get it. Up to a point of a neonate.
Wow.
You know, a child that has just been born
wow.
can even get it if the mother has coronavirus, because they'll be breastfeeding.
Yeah.
You know, with
There's
that
that
breathing,
contact.
that
Wow.
yeah, there is that contact. So anyone and everyone can get coronavirus.
No
However,
one is safe.
Yeah, no one is safe.
No one is safe, babukeli. Asiyekele ukuthi sizikhohlise bantu abayangi sibhizi sisasanka ey'tradini. No one is safe. Ungabe ugijima ama-marathon wena u-healthy, awuna diabetes, awuna shukela, awuna ma-chronic illnesses, ubese ucabanga ukuthi no, mina ngi-right, I'll continue shopping, I'll continue going about with my life. No one is safe. Sonke, noma ngabe ubani, as much as ugogo, nawe uyang. So please, ngiyacela babukeli, let us take this seriously.
Yeah. So obviously with that, having said that, you know, there is a group of patients who may develop severe disease or who are at risk of developing severe disease. For example, diabetics, people that are hypertensive, people with high blood pressure. In our setting in South Africa, HIV being one of the things. People with cancers also have, they are at increased risk of developing severe disease.
Okay.
The elderly as well are at increased risk. However, we've seen patients who are, I mean, even in social media, people who are young and looking healthy, but succumbing to the disease, you know, dying from the disease. That we thought we, maybe, you know, the still youngish people will not die from corona, but people have died. Even children.
Even children. And we cannot emphasize that more, babugeli emakaya. Ukuthi, yazi, we need to take this as serious as omunye umuntu lapana that is at a risk of getting severe disease. Even if you are young, even if you are healthy, we need to take it just as serious, because once again, no one, and I mean no one, is safe. Now, siyakumbuzana futhi ukuthi we will be opening the lines in, you know, kungekudala, we're going to be opening the lines. So please, asilungiseni ama phone wethu so that sizokhona ukuthi sikhulume naye udokotela. The number to call ngintshele while nisalungiselela ukuthi nizosifonela, it is 011 676 6836. Ngizoyiphinda futhi, it's a number 011 676 6836. While sisalinde logo sizoqhubeka sikhulume naye udokotela. Now, doc, please, can you explain what is the purpose of screening? You know, ungena kuphi, kuyascreenwa. What is the purpose of screening?
So with the purpose of screening, remember, this is a public health problem. It's a pandemic. And when we screen in order to be able to detect the cases.
Okay.
To be able to detect the cases so that they may or will seek medical attention.
All right.
That's number one. Secondly, so that other people get protected.
Okay.
Yeah, so that, you know, the disease does not spread. Yeah, so that's the purpose of screening
So why ukuthi basimoshela isikhathi nje ukuthi yazi ish man ama temperature manje yini manje yonke into kose uthi no. And the doc, a lot of people probably aren't even reading, you know, all the what you're being screened for, and you're just saying no. Please, can we just put an emphasis ukuthi it is actually important that you are honest with the symptoms if you have any, you know.
Symptom. I think it's for the best of the nation.
Yeah.
To be honest with your symptoms, and the other thing, to be honest, if you have been in contact with a person that has tested positive.
And now, doc, that now poses a challenge. Komunye umuntu ukuthi I would love to be honest, but I may just lose my job, or you know, bazongibheka njani, or I don't have the means. Let's say, you know, dokotela, I do not have the financial means ukuthi ngihambe ngiyotesta or in. So what's the point? Omunye usho njalo ukuthi what is the point ukuthi ngisho ukuthi yes, maybe I'm experiencing this and that, kodwa at the end of the day angeke ngikhona ukuthi ngiyotesta.
I think according to NIOH, I forgot what but it's, you know, the Occupational Health, National Institute of Occupational Health. So there are labor laws. So if I come into contact, let's say I'm at work, I come into contact with a person that tested COVID positive. So what we call close contact. And close contact, when you're talking about close contact, a close contact is someone that you have spent at least 15 minutes less than a meter away from. More than 15 minutes less than a meter away without protection, you know, without protective clothing. That person is considered your close contact. So maybe at home, it's someone that you having dinner with on the same table, and you might have shared eating utensils. That person will be considered a close contact. And at work, it might have been maybe your colleague. You were in the same room for a longer time, for more than 15 minutes, and you were not wearing masks. You know, so that is a close contact. So having said that, when you are a contact of a positive person, what we encourage, or what the law says, is you have to quarantine. You are not positive yourself, but you quarantine and you observe yourself. And if you develop symptoms, you have to get tested. And if you do not develop symptoms, at least after 10 days, you can go back to work.
But now, doctor, umuntu uthi, if yes, I haven't tested or anything like that, but if now I'm going to talk to my employer and say I need 10 days off, you know, because, you know, I need to quarantine, abanye bayasaba ukuthi I'm going to lose my job.
I know it's a reality, but there is labor law out there that you know, a person is sort of protected as long as you are employed legally, if so to say. There may be a certain challenging situation where people really, you know, maybe someone is a domestic worker, they are not registered. However, it does not give anyone the right to, you know, not to give them the time to be quarantined. It's not for that person only, but it's even for their own benefit. Because should that person, you know, sort of also be positive, they would have exposed you. So it's like from one person to maybe 2 people, 4 people, 16, and sometimes even, you know, you multiply, because I meet you, I infect you. You go, you meet with 3, 4 people, you infect them. Those 4 people go meet whatever number of people. So that's how the virus spread. And by being quarantined, you prevent that. And obviously, a person that has been diagnosed positive, we say that person is isolated. I know people use those terms interchangeably.
So, isolation, if you have been tested and you were positive, then when isolation, when you test, you i-quarantine.
Yes.
Ngiyibambe kahle dokotela.
Yeah.
Phela siyafunda la, you know, siyafunda so nani-ke ningathi bese niyigcina la. Uthi usufundile uthathe uyifundise nabanye ukuthi manje uku-quarantine isolation. So now, doc, we need to move on to the next point. Ukuthi, okay, lokhan bebathi 14 days. March sebathi 10 days. Kahle kahle yini? And you know manje futhi kuthiwa noma ungakatestanga ukuthi so negative, so uyakhona ukuthi you can go back and go about with life, provided obviously you know you are not getting you're okay, you've recovered. Why has it now been, you know, 10 days? It causes a lot of confusion out there. Ukuthi yini usehambile after 10 days?
So coming to that, it goes back to our point of saying, remember, this is a novel virus. We've never dealt with this before.
Yeah.
There is research out there. So with the change of the new guidelines now to reducing isolation period or even quarantine to 10 days, the reason being that it has been found that, you know, the virus, remember that the virus, like I say, you can detect the virus on the surface. However, if that virus is dead, it's not infectious.
Okay.
So with the new research, what they have found is with people, as they, you know, they start, they are asymptomatic, the virus is there, they test positive with the PCR. So
Yep.
PCR will detect the gene of the virus
itself.
of the virus itself. So it detects that, and once that has been detected, what is more infectious is the virus that is alive. So they did test, you know, research, and they found that, you know, on around day 8, most people, even though they may still test positive on PCR, it's just the gene that is detected. The viable or the live virus is no longer there. So they did test, and they, what we call to culture a virus, and they found that, you know, after 8 days or from day 8, that virus is no longer viable. It's no longer alive, and because it's no longer alive, it will not be 8 to 10 days. And according to WHO guidelines, they came to 10 days. So the South African guideline has adopted the WHO guideline.
Ngiyathemba ukuthi sizwile babukele emakhaya. It does not mean ukuthi ayisekho. You may still test positive, but it just simply means ukuthi, you know, the viable virus le infectious, ayisekho infectious. So akusukuthi ngempela you now need to go again and test and find ukuthi usu negative. You may very well find that you are still positive, because remember, it test esiyenzayo, it just detects ukuthi, you know, the virus itself ikhona na. And so it is ukuthi ke after 8 to 10 days, it is no longer viable, meaning it is no longer infectious. So asifundeni sazini, you know, knowledge is power, dokotela. After all, you know, if you don't know something really does make sense, but you've really clarified it, and I believe now they understand, because we tend to question a lot. Why manje? In no usagula, no kosa yohlala for an additional 4 days ngoba uzoskulisa but we thank you so much ukuthi you
so
shared
maybe
that.
let me clarify in terms of, obviously, if the person is still symptomatic, then you tend to be conscious.
All right.
So the other thing is you would say that person, for example, people with severe diseases, a person that went into ICU, they may shed so the virus for a longer period. And so that's where we have obviously an asymptomatic. So that's why the guideline will say, you know, so there are people who test positive but they don't have symptoms, or they have mild symptoms. So those with mild symptoms, maybe, you know, they can stay for after 8 days. They can get out of isolation. And but if a person who was in ICU may shed that virus for longer, and maybe what you can do is to count from the number of days when they stopped having the symptoms, especially if they were in ICU.
All
also.
right.
Yeah.
It is very clear, Babugeli. Once again, utu dokotela ungaveli uti okay 8 days. Cha 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 cha.
10 days, that's
Yes.
the
I mean,
WHO.
ungaveli uti 10 days. Apologies for that. Ungaveli uti 10 days. So if you were asymptomatic, if it was a mild disease. So manjeke Babugeli emakhaya, we're going to be opening up the lines. Esevuliwe ningafona nizokhuluma nayo udokotela nizibuzele and ni communicate naye. The number to call is 011 6766836. 40, the number to call is 011 6766836. Now, Doc, can we just, while we are waiting, prevention measures, sitshelwa ngama-sanitizer and bathi kose abe ne-alcohol, utshwala, so abanye bathi okay, so mangingathatha ibev right na. So Doc, please take us through the different prevention measures and really why, why a mask, why a visor, why a sanitizer?
Okay, so like I said, remember that with the way the virus is transmitted, it's transmitted through contact, like I've already said, and then also through droplets. And now with the new evidence that it might also be an airborne. So with the hand washing. So remember, it's hand washing. Ideally, it should be for 20 seconds. And in that 20 seconds, you can it must be done thoroughly.
Okay.
All surfaces.
So doctor, what is thoroughly? Please, can you demonstrate thoroughly? Ngoba ngavele ngithi mina ngimloyo thoroughly. Please, what is thoroughly?
So every surface, the back surface,
okay,
in between the fingers, and the palmar surface. This surface must also be,
right.
So obviously this side,
okay,
in between, and outside, and you do this, and then you rinse,
okay,
and you must dry.
Oh, you must
don't
dry.
just wash and.
Yes,
okay. You must dry, and ideally a tap that you're going to use. After you have washed, you don't want to touch it again.
Okay.
So if possible, maybe take a paper and then close the tap with that paper. And then dry your hands. And then you are good to go. For 20 seconds.
20 seconds. Shaya ngapha, ubuye ungene ngaphakathi, uze la phambili, ubuye futhi nangapha. So the same thing oyenza ngala, mele uyenze nangapha, ushaye ngaphandle, ubuye phakathi, and then niyabona ne le izoshaya 20 seconds. Hayi ukuthi uvela uthi masinya, as long as izandla zingenile emanzini. No, that is not enough. So if ungekho yenza right, yenza into right, please.
From now on.
Yes, sizoyenza right akithi.
So so in the absence of water, let's say you are in a supermarket, there's no water, you must use a hand sanitizer. So this hand sanitizer must contain 70% of alcohol.
Okay.
So obviously the alcohol that people drink is how much? Like 5%. And then sometimes, I don't know the strong one, how much, but they don't go 70%.
Okay. So even if it's just pure, it's pure alcohol. So like ingafiki lapha ku 70%, I see.
It doesn't. You need 70%. And what is important is it's not only about the concentration that's in there. It's also about what we call contact time.
Okay.
I don't just do
the contact time.
Yes.
So please, doc.
So you spray.
Okay, I'm gonna spray you. Babugeli ngicela ukuthi sibhekisiseni kahle.
So obviously you spray, you make sure all the surfaces have been, and they are covered.
Okay.
So that contact time, you don't just do, there must be a contact time, because with any antiseptic or any disinfectant, it's not only about the concentration, but the contact time is also important.
Okay.
Okay. So that's number one in terms of prevention, especially with contact. And what is also important, like I said, I can touch a door handle. You come and touch it. So if I have the virus, maybe I was coughing and then touch that, that virus is on that door handle. You come, you touch it, you get infected. So it's also encouraged that we wipe surfaces, especially what we call high touch surfaces, like your door handle, the switch at home, the surfaces. So make sure that you wipe them with water that is mixed with bleach.
Okay.
So that is
bleach dokotela.
Okay,
fan.
Yeah.
Faga nje, faga.
Ufake,
Yeah.
yeah. And then you clean the surfaces or any other area that you touch frequently. That area must be cleaned properly. So that is with contact precautions. And then regarding the mask, remember we said it's droplet spread. So the masks are there to help with. So I protect you, you protect me.
Okay.
So hence it's important that we all wear masks. So because if I'm going to talk, and you know sometimes it's unbelievable, we think when we talk there's no saliva coming out. Try to talk one day on your phone, clean the screen of your phone, put it close to you, you'll start seeing those so you know, so that is what we are preventing by wearing
your mask. So
wearing
it's not
your
just
mask.
for me, but also
Yeah.
the
So we
next
are
person.
protecting. So it's an effect where I protect you, you protect me.
Okay.
Yeah.
So dokotela, yazi we've been hearing things ukuthi mask enjani, mask engasinjani. Does that matter?
So with regards to mask, it's recommended that at least if it's medical masks, so what we call the surgical mask and also the N95 respirator are preserved or should ideally be used by healthcare workers.
Okay.
Okay. And then for the public, we should be using cloth masks.
Okay.
So ideally, it should be a 3-layered mask for it to be effective. And what is also important, it must fit. Don't wear your mask with your nose showing. Like, you know, people put it here.
Yeah.
And sometimes, you know, it's on the chin or wherever. And it doesn't fit properly. You can see that. So it must be a nice, tight fitting mask. Not tight as in, but it must fit properly. So that's what masks are for.
Okay.
And then obviously with the visors, we are, you know, for some people may not be able to.
Asibakhomba visor dokotela. Yes. So na visor. Yes, doc.
So with a visor, for those people who cannot, maybe they don't tolerate masks or at least a visor will also stop the droplets.
Okay.
Because like I said, when you cough or the way you know, your droplets come out in a linear direction.
Okay.
This is how they come out. Yeah.
So doctor, it won't go emasidini mhlambe.
Remember that the chances most of the viruses,
Yes.
like I say, will go this way. So that's what you are trying to catch. Yeah, but ideally, obviously, yeah.
Okay.
Yeah, you would want to wear a mask.
Okay.
Yeah.
Okay, because hey, doc, we're seeing people flex visor. So it's very important, as you're hearing from the doctor. So why ini ibalulekile? Now, doc, abanye bathi, okay, imagine noma ngigijima vele kumele ngifake mask. I like jogging, and when I'm exercising, really, do I need to wear a mask?
So I think in those cases, it depends. I mean, if you're running and there's no one around you, I guess you can. But even though it's recommended that, you know, you wear a mask, I guess it may be uncomfortable. But remember that if you're going to be meeting people, passing people by, I protect you, you protect me.
Okay, wow.
It's a public effort.
It's a public
Yeah,
effort.
it's not
So
one man's show.
sibambisane, ne?
Yes, yes.
So mele sibambisane asibambisane babugeli emakhaya. If we want to beat this thing, we need to do it united, because divided we fall.
That's
So now,
true.
Doc, we want to know.
Or the other thing that we forget,
Yes.
social distancing,
Hey.
quite important.
Dokotela. So nje, this is not social distancing.
So ideally, remember we say 1.5 to 2 meters. I don't know if my hand will be 1.5. Yeah, but you know, ideally there's the distance that the next person should be at. And the reason being, once again, with droplet spread, droplets are known not to travel further than 2 meter, that 2 meter distance. So that's where the whole rationale comes from.
Okay.
That at least they will drop before. So it also comes to a point where, to avoid crowded areas, and avoid where there is crowd. And if you are in a place where there are few people, make sure that you maintain that social distancing.
Okay, so Doc, is it safe to say, Uguti, if I combine all these measures as opposed to just using one? Is it so, like, omunye ngathi, okay, so if ngishaye mask kuphela ngingashayi social distancing, ngingashayi sanitizer in, so it's more effective ukuthi usebenzise all the measures of prevention. So social distancing, shayi mask yakho, ushayi sanitizer, ugeze nezandla futhi, that is important.
And the other thing that we forgetting is, the cough etiquette, or this, or, when you sneeze, don't sneeze in your hand. If you sneeze in your hand, make sure that you wash it immediately.
So rather, uyishaya la dokotela.
Yeah,
so uthi nje current nyana ukhohlelele khona lapho. No, Doc, the next thing one is asking us, okay, yes, I may be fine, I'm okay, you told me what I can do to prevent, preventative measures, but for myself, can I take something? Yes, kuthiwe vaccine ayikho, but nje is there anything I can do right now to help myself?
So I think in terms of things that can be, there are lots of remedies out there.
Yes, there's so much. Dokotela bathi jinja ibeka le, enye uyibhekisa le. Hey man kuning.
Yeah, there are lots of, I personally, this is me personally,
Yes.
I think, if you eat healthy, because most of them, it will be, your multivitamin, take this. But if you eat healthy, you probably have all those micronutrients that you will get from your multivitamin.
Okay.
But if you feel you have deficiencies, you can maybe
Ilapho.
supplement.
Okay.
However, remember that does not necessarily protect you from the coronavirus, number one. And then it also doesn't mean that it's curative.
Okay.
Because people think that if I take that, then if I have coronavirus, then it's a cure. So those are the things that we need to understand. And there are also other home remedies that, we see on social media, some of them that I think may be dangerous.
Doc, please, asiwasho yimaphi ngoba mhlambe lapha emakhaya you religiously doing that thing because uyibone bathi.
You know what? I mean, I recently saw on one of the things that bicarbonate of soda with lemon. That's like handy Andy.
How about it?
Like, I mean,
handy
really. You see, so some of those practices are, or some of those things that we see on social media. And then 2 days ago, I saw another one, with all the mechanism of coronavirus forming clots and whatever. And there was one that says it encourages people to take Disprin, and there was one that says, heparin or warfarin, in brackets, Retex.
Yay.
So you see, that's where the danger is, that people will take things that they don't know what they are, what they're gonna do to the body. And in terms of, our herbal medication, I believe everything taken in moderation will not harm. However, I personally will urge people to be careful of what they ingest. Because what you put in your mouth and goes to your body will go to your kidneys, will go to your liver. And if it's something that is maybe harmful, and you'll find that, some people, they are elderly, their kidney function, it's not great. So they may already have a compromised kidneys. And they'll be taking all this other concoction that may compromise. Yeah.
Wow. Doc, you mentioned herbal remedies. Now, angeke siziqhubeke kule show singakhulumanga siyayazi ke lempintshi ibizwa ngomhlonyana. Yabona ilo mpintshi ukonke manje. Wonke yazi konke ubona abantu bayethengisa umhlonyana awusazi noma ngumhlonyana or umuntu vele waye efieldini nje wathatha into green baqeda uthi nangu umhlonyana. Doc, umhlonyana. Yazi umhlonyana usafe. Siwuthathe na siyabuza usafe na ngingawuthatha noma ngabe ngubani and if ngiwuthatha isikhathi esingakanani?
To be honest with you, I honestly cannot answer that question. I know there was, I think, was it around March, April? There was a study in Madagascar that showed one of the plants, they call it artemisinin.
Yeah.
And people said, oh, this is umhlonyana, this is the same thing that we have in South Africa. So I cannot, it's difficult for me to answer to that because I don't know what the contents are. And with regard to that finding in Madagascar, it's something that is not entirely proven. And whether it cures, that's another thing. And I know people will say, no, Dallas tattoo umhlonyane sibancane, and it's fine. Maybe then you are taking it with a teaspoon, taking it for a few days. What has been the trend now is people are galloping it with cups and cups every day. So you basically don't know what it can do to your system. So that's why I urge people to be careful. I'm not saying it will. I'm not saying it, I'm just saying people should be careful out there.
Wow. Babugeli, please, ngiyacela ukuthi sizwe futhi sizwisise. Too much of anything, Dokotela, as you mentioned, iyinking. It may be ukuthi right, whether right or right. We can't say. Remember, we in the beginning of the show, Shishilo said we want to bring you evidence-based medicine. Isn't this hazi ukuthi vele it has been proven ukuthi iyasebenza. So please ningathi udokotela uthe. Whatever you do, remember into yenza kakhulu then ayikho right. Too much of anything or too little of anything akusiyo. Doc, so now omunye uthi ay mara manje mina dokotela sengiconfused ke. Angisazi ke ngiyenzeni vitamin C wami ngimyeke omunye uthi I've stocked up on vitamin C ngathatha bo vitamin D ngihlanganisile enhleki bona kami I have opened a pharmacy ngoba nginayo yonke into. But now ufuna ukuthi okay doctor ngiyenzeni ke ngithathe ini ngiyekele ini because right now I really don't know.
With everything is you must ask yourself, why are you doing something? Is it for prevention? And if it's for prevention, has it been proven to work? Iproviwe ukuthi iyasebenza or ayisebenzi. And so some of these things, like I say, with supplements are there to help our body, especially when we lack. However, if you don't necessarily lack, is there really a need to be taking those supplements? There is evidence that, a vitamin, actually those are hypotheses. And there are papers even released that, they may be hypotheses. Niacin, vitamin C, zinc, and vitamin D. I mean, in hospitals where patients, some ICU, where patients are admitted with severe coronavirus, they do mix that concoction. But remember, it's in a setting where it's controlled, number one. It's in a setting where a person already has severe disease. And they do acknowledge that, this is a hypothesis. We are, So whether to take or not, to be honest, I think it's an individual choice. I personally don't.
Okay. Siyabonga kakhulu dokotela. We just have 5 more minutes. But before ngifuna ukuthi siyabonga kakhulu kini enisjoinayo live on Facebook. Siyambona nangu uvangile Mazibuko. Theo Sigenu, we see you. Kanti futhi someone is saying, "Doctor, where do we get visors?" Like any visor works, doesn't matter.
I think any visor, remember you just protecting yourself from that direct droplet spread. Yeah, it depends on the situation. For
Okay.
example, if you are working in a medical environment, it's not any other visor. It has
Okay.
to be a visor of a certain thickness because there you are at increased risk
Okay.
compared to, yeah.
All right.
Yeah.
Ay siyabonga kakhulu. Siyathemba ukuthi uyizwile ke leyo. And futhi siyambona uMathundu aphelele. Siyabonga no other bongane. Siyabonga kakhulu ukuthi nisijoin. Siyathemba ukuthi nani lapho emakhaya niyafunda. Kanti ke asikakayiqedi indaba yayo i-coronavirus. Kanti ke nginitshele ukuthi ngeviki elilandelayo we are bringing in kanti gaye udokotela oke she works in the field and she contracted the coronavirus and she is back at work. Uyasebenza uphilile ululamile, just so that you can hear ukuthi uyazi ukuthini wenze njani kwenzakaleni, everything behind it, even the mental problems, the mental issues that is associated with this. So please siyaqala abukeli amakhaya ukuthi ngesonto next Friday, please do join us so that you can hear firsthand. Doctor, we just want to say thank you so much. Ngiyathemba ukuthi you know what, everyone at home, they are more informed than they were 50 minutes ago.
Thank you.
Siyabonga kakhulu. Sesizothi kini nisaleni kahle, niziphatheni kahle. Kanti masithi niziphatheni kahle, siyakhumbuzana nje ngaso sonke isikhathi ukuthi social distancing, it is very very important. Kanti futhi ungakhohlwa, always have your mask on. Mawuphumile uye ngaphandle wherever. Yazi noma ngabe into encane kangakanani, please remember, it is me protecting you and you protecting me. Futhi ke i-sanitizer ungayikhohlwa, you spray. Mara ungagcini lapho. If you get the chance ukuthi wash izandla, do wash your hands, uziwashe kahle. Siyabonga kakhulu kithi from Holistic Healthy Living. Sithi masibonane ngeviki elilandelayo.
Madoda, sesifikile leso sikhathi sonyaka. Siyazi ukuthi njalo